Let me check, make sure my audio is good. Okay, great. So in this class, what I'm going to address is core gut myths. And this is Oksana. My sister and I, over the last decade, we've helped hundreds of people globally reverse all types of autoimmune diseases, including arthritis, Hashimoto's, kidney disease, and we've worked with also clients who struggled with gut issues, whether they had IBS, diarrhea, constipation. We had a client who had gastroparesis that we worked with. He couldn't go to the bathroom for days and weeks at a time. We got him going every single day. And we also worked with clients who had gastritis. Some of it were really severe cases. Other clients we've helped had Crohn's colitis. You can go to our website and share the type of results our clients have seen in only 40 days of us working together. So in this presentation, I'm going to address the core gut myths, and I'm going to cover some of the topics that you have been conflicted about, that we've seen our clients be confused about, but as well as what we see on social media. So the first thing I'm going to talk about is getting into this topic. Confusion really creates illusion. And let me know in the comments, or if you've really been confused out there, because if you go on Instagram or if you go on TikTok, on social media for 1 minute, somebody tells you, drink raw milk, it's really good for you. Somebody else tells you, don't drink raw milk, it's going to kill you. No, do not eat grains. Grains are going to kill you. Or they're going to tell you, carnivore diet is the best diet. So there's a lot of confusion out there. And some of it is intentional, some of it is a byproduct, but ultimately it is somewhat to create an illusion. Everyone's confused and no one knows what to believe, but we always teach our clients, believe the results. So there's a lot of health coaches out there, nutritionists, who tell you that they can help you, but they don't have any results. So the most important thing you need to believe is the results that the patients or clients are getting, but as well as how long it took them to get the results. So this confusion applies to the gut because there's so many factors that go into our gut. The gut is its own ecosystem. So a lot of times we'll try to throw an antibiotic into the ecosystem and just expect it to magically balance out all the different types of microbes that live in there. Because we have bacteria, we have fungi, we have parasites, we have something called archaea, we have protozoa or parasites. So there's a lot of different types of microbes that live in a gut. And sometimes throwing in one herb or antibiotic or one probiotic is not going to take care of that delicate balance between all of those different members of the biome or microbiome. And it's not necessarily going to help you with the flow of those microbes. And it's not necessarily going to help you with the barrier or the gut lining of those microbes. So when we help our clients recover, we don't focus on type of supplements they can take. We tell them how to create the right environment for their gut to heal itself. That's why we've had clients who had bloody stools and diarrhea stop. We also had a client who had really severe colitis, and the functional doctor that she was working with and the advice that her functional doctor was giving her put her in the hospital. And her medical doctor was going to cut out her colon, but her bloody stools stopped within 1 day of us working together. And she's a client who does not live in the United States. She was able to find us and get help. So that's why one herb, one antibiotic or probiotic won't fix this delicate balance. And some people will tell you don't need to eat fiber. Fiber is really not essential. And so let me know in the comments, or maybe that if you've heard that before. And one of the big questions is fiber needed for healthy gut? And the answer is yes. And why is that? Majority of the research, and again, we could sit and talk for 2 hours through all the different types of research. And this is something that we go into details with a lot of our clients, and we personalize their recovery plan based on their gut and the health of their gut and what they can tolerate. But we can spend hours going over different type of research and articles and clinical trials. And the studies, even since the 80s, are showing the importance of fiber. So fiber is essential carbohydrate, where we have essential fatty acids and we have essential amino acids. So what does this mean that it's essential? What does this mean that it's essential? Do you know what it means? If Fiber has essential carbohydrates and fatty acids. So essential means that we have to get it from a diet. We cannot make it. Our bodies don't produce these essential carbohydrates or these essential fatty acids found in fiber. We have to get them externally. We don't make fiber because we're not plants, right? So we don't make fiber. Plants have fiber. So fiber is not just there for us, but for our microbes, which are then for us. So it's like it benefits us in the indirect way. Does this make sense? So I'm going to address other core myths, such as why do some people feel bad when they eat more fiber? And we're going to talk about histamine. We're going to cover different topics in here, okay? So one thing to really understand and remember is that the layer in your gut, it can get degraded over time. And major prevention tool for that is actually eating fiber. So we have seen this confirmed in study after study, whether it's an animal study, a human study, or randomized control study. The evidence for this is overwhelming and consistent. And the reason this understanding is so important is that many people don't realize how delicate the gut barrier truly is. We have a one gut epithelium that's in our gut. So it's one thin layer of cells, essentially a gut skin that lines the entire gastrointestinal tract from the mouth to the anus. So it's really just a gut lining is one cell thick. It's thinner than a skin on a face. So most people are familiar with what solid organs like the liver, the heart, the brain look like. They're dense, they're muscular, and they're full of fibrous tissue and nerves. Your gut is completely different. It is a hollow organ, and its lining is only one cell layer thick, about 1 millimeter, making it even thinner than external skin. So think about it. Just think about that your gut is so thin. The cells in your gut lining are just 1 millimeter thin. And this is remarkably delicate for an organ that handles our digestion. It houses over 80% of our immune cells. It manages motility. It connects to virtually all of our other organs, including the endocrine, cardiometabolic, cardiovascular systems. So many bodily systems are directly influenced by the gut. So this brings us to the really crucial question: why is it so fragile? The answer is that we rely on a protective shield known as a mucosal barrier, a thick layer of mucus. So our gut is really protected by a thick mucosal barrier, and the barrier serves two critical functions. This mucosal barrier in our gut, it ensures the right things stay in the gut and the wrong things stay out, preventing the immune system from becoming confused and triggering autoimmune diseases. And it also acts as a cushion for the vast network of nerves. So the gut is the second most innervated organ in the body, often, after the spinal cord. So you need this mucus to create a barrier so those nerves aren't constantly sensing every movement. So what does this mean? This means if you have inflammation in your gut, if you're struggling with gastritis, gut issues, autoimmune diseases, it means that your gut is not healthy and this mucosal layer has been destroyed. So when we hear clients who report to us, they tell us that they feel everything. They awaken at night by the sensation of stool moving through their system or by every bit of gas. So they feel all this gas, they're feeling sensations in the digestive system. And this is not just uncomfortable, it's painful, and it's a direct result of that protective mucus barrier being heavily degraded. So if you feel like you can feel everything when you're sleeping, you can feel your food is being digested and moving around or moving down your digestive system, it means that your protective barrier has been compromised. So we know that fiber is what keeps this mucosal barrier rich and healthy. Fibrous foods, particularly those containing specific starches and carbohydrates, like resistant starches, are essential for maintaining a thick, healthy mucosal layer. And the gut microbes will maintain their own home just as we do. And so what does this mean? We don't go around breaking down the walls and doors of a house. We want to live in a healthy environment. And your gut microbes are the same. They will keep that protective layer healthy if you provide your microbes with the right foods. So when it comes to healing your gut, it's not just about taking a bunch of supplements or probiotics. It's also giving your microbes the right food that they need to eat to thrive. And so the bad microbes don't overgrow and the good microbes stay healthy, including yeast. Okay, so we want this layer to be really thick and rich, this mucosal area. However, when you're in a survival mode and your microbes are starving and your microbes are in a survival mode, they will look around for resources. And that's exactly what they do. They will consume this layer of mucus. So your microbes are actually going to eat this mucosal area, this mucosal barrier, which is rich in carbohydrates, starch, iron, vitamins, minerals, and even some fat. So if your microbes are starved, they will feast on your protective mucous lining first and foremost. Therefore, a lot of people who struggle with gut issues, eliminating certain foods from their diet, including fiber entirely, it does not solve the underlying problem. In fact, it can quickly lead you down a path toward autoimmune diseases and other serious conditions. And that's why we must emphasize that a diet that's completely has no fiber is not the solution. And if you follow stories of long-term carnivore influences, you'll notice them telling you that, one time I I just ate all meat and then I couldn't eat all meat and I started to introducing fruits and maybe a few vegetables and eventually some nuts and seeds. This demonstrates that this is not sustainable to just eat only meat only diet. And because I got microbes, they do need that fiber. And you may think you don't need it, but they need it. Okay, so, and if your gut is not healthy, then that's when people start experiencing health issues when they eat more fiber. So we have people and clients coming to us, I can't eat more fiber because they're getting stomach pains. Their whole body is inflamed and damaged by an autoimmune disease. So we always find a path that works for them. And most people tell us they eat really healthy, but they still have an autoimmune disease. And there's healthy foods, including alkaline foods, that are still inflammatory and damaging to not only your gut, but your immune system. So myth number 2, do plants have toxins that destroy the gut? So the mucus layer is critically important. We rely on it for the extra protection. When you don't eat fiber or you lack adequate fiber, you lose that protective layer. You lose your protective layer. So this is precisely why if you suffer from chronic GI issues like IBS, you might find yourself getting sick more easily, whether it is a common cold, whether it's a COVID or other illnesses. And without this protection, you can quickly find yourself dealing with autoimmune and other immune system issues. Unfortunately, this creates a deepening cycle that becomes increasingly difficult to escape. This leads directly to a question. Do plants have toxins that destroy the gut? So you may have heard people discuss anti-nutrients, which has become a major point of confusion and a selling point for those claiming you shouldn't eat certain type of fiber. And this argument is that these compounds chemically bind to your nutrients. However, the reality is that the foods containing these so-called anti-nutrients are among the healthiest you can eat. So for example, oxalates are found in spinach and legumes. Crucially, we have we have preparation methods to address this. We cook legumes. Nobody's supposed to be eating beans raw. And majority of our clients who work with us one-on-one, they do not have to eat legumes to heal their gut issues. That's where confusion comes in, because when you're making assumptions, what we do, how we do it, and you start making wrong decisions, and you don't know what kind of recommendations we would give you for you. But what I'm trying to tell you is that we cook these foods. So these foods also contain enzymes that create a beneficial synergetic effect when we eat them together. And the scientific evidence strongly supports it. So we can look at data from randomized controlled crossover trials that measured C-reactive protein, a key marker of inflammation in the body. In one study, researchers divided people into two groups. So one group ate whole grains, and again, this is an old study, while the other ate zero grains and zero fiber. And results was clear. The group that was eating more fiber, the C-reactive protein levels actually decreased by 21%. So the inflammation marker went down significantly, why people who were consuming, people who were consuming these lectins, phytates, and oxalates, the actual inflammation markers went down because it was a crossover trial. Then the researchers they switched, right? So the people who were eating more fiber, they put them on a low fiber diet, and they saw the inflammation marker increase. And this demonstrates that not only did these compounds that they say that they, anti-nutrients, not only they decrease inflammation, but removing them had a negative effect. So again, there's so many different foods people can eat on any type of diet, but this is what this one study showed. And remember, preparing different types of food, or blending them, or fermenting them, or cooking or soaking them drastically reduces these so-called anti-nutrients that people try to scare you and tell you about. Another thing you have to understand is that the conclusion from these well-designed trials is undeniable. We see marked decrease in inflammation, which is a hallmark of both existing autoimmune diseases and its development. Furthermore, populations data provides compelling real-world evidence. All 5 blue zones regions with the highest concentration of, people who eat a high amount of oxalates, nightshades, lectins, they have lowest rates of diseases. And meanwhile, in the United States, as a consumption of these has decreased because people, oh my God, I can't eat oxalates, they give you kidney stones. I'm going to address that as well. Is average Americans are consuming about 8 pounds of, let's say, beans per person annually. And that was, 50 years ago. And now they're consuming, it went down to 6 pounds. So during this same period, we have not become healthier. We are seeing more gastrointestinal issues, more cancer, and more chronic disease. So is eliminating these foods truly healing you, or is it merely providing temporal symptom relief? So there's a profound difference between the two. That's what you have to remember. A lot of people, if your gut is not healthy, it's not going to be able to tolerate these foods. But if your guts get healthy, you can be able to tolerate more of these foods without having symptoms. So again, our clients who work with us they don't have to eat any legumes or beans in order to heal. But the problem, another confusion with oxalates is that the main cause of kidney stones is dehydration and consumption of high protein. Especially with all the protein powders out there, people are over consuming on protein that leads to the kidney stones. And dehydration is another main reason. So whatever you read online, it's just haven't been true in real world results working with hundreds of our clients. So to be clear, our plants, do they cause IBS and GI issues? So what does cause these conditions? So the issue often begins with dietary displacement. When we eat less fiber, we typically replace them with something else, usually more protein and more saturated fat, and often more ultra-processed foods. And this could be a highly processed protein bar or other sources of refined carbohydrates or proteins or fats. This shift in diet directly alters our digestive juices and fluids. So what does this mean? This means people, do you know that protein powders are ultra-processed, which makes them inflammatory? So when people actually eating less fiber, they start eating more of those foods that are actually inflammatory on a cellular level. So for instance, increasing saturated fat intake, it affects bile acid production. What does this mean? Proper digestion is a cascade. It starts in the mouth with saliva, it moves to the stomach where acid breaks food down, and then relies on bile from the liver and enzymes from the pancreas for absorption in the small intestine. So the composition of your diet can drastically change this entire process. Excess saturated fat specifically can increase the production of inflammatory secondary bile acids, which damage the crucial mucosal barrier we've discussed. Furthermore, a significant number of Americans use proton pump inhibitors, which is one of the most prescribed drugs in this country. What most people don't realize is that these medications are only recommended for use up to 3 months, even by the manufacturers. Yet it's common to find people who have been on them for decades. When one part of the digestive cascade is disturbed, it has downstream effects on all others. So this chain of dysfunction can start anywhere. If you don't produce enough saliva due to dehydration or conditions like Sjogren's, which we helped clients become symptom-free from Sjogren's within 21 days, we've had those cases. It affects how food is processed in the stomach. If you don't have enough stomach acid, it fails to trigger the necessary signal to the pancreas, liver, and gallbladder to release these digestive juices. Add to this the impact of antibiotics, which disturb the microbial balance further down in the intestine. This throws off the gut's ability to manage inflammation, produce beneficial short-chain fatty acids, and control harmful substances that it comes in contact with. So the consequences of this imbalance then extend far beyond the gut, affecting the heart, the endocrine hormones, the neurological system, and increasing the risk of diabetes, high cholesterol, hypertension, and neurodegenerative diseases, which we teach our clients how to reverse all of these conditions. They get access to all the classes and personalized recovery and guidance. So this is why the core principle we teach when we work with our clients is really powerful. A healthy mucosal barrier is fundamentally dependent on you eating foods to heal. So by understanding this, you can cut through the confusion and trust the process of nourishing your gut with the foods that is designed to run on. So I hope this made a lot of clear, but I'm going to keep moving with this presentation. So why do some people eat worse when they eat more fiber? I had so many people come to us telling us that. Even people, like I said, we worked with clients who had diarrhea. We had a client who had colitis and she had bloody stools. She was going to the bathroom 12 times a day. 12 to 16 times a day. We got her down to going to the bathroom to 4 times a day. So when I tell you that we had those severe cases and we've been able to help them and reduce the inflammation markers, that we know what we're talking about. So maybe you heard other doctors and dietitians and people in conferences saying, do eat more fiber. But what do some people feel worse? From the second you were born, you were exposed to microbes, even in the womb. And from the second your mother gave you home microbes, either through delivery or hugs or breast milk, whatever it is, this factory was turned on. So, and I have a really long, detailed class about this for my clients as well. But in recent years, we've identified that if the factory is broken, like you have dysbiosis, so you have low motility, you're not going to the bathroom, you are constipated, adding more fiber can cause backups. So that's why people can experience gas, bloating, a sign of a broken process, not a problem with the materials. So that's why the goal is always to fix your gut, not blame the fiber. And so people feel better when they remove certain foods, but that's only going to make your condition and your disease worse, and it actually makes your gut weaker. So in recent studies, we've identified a common hallmark of IBS, so a significant microbial imbalance known as dysbiosis. So dysbiosis just means that you have imbalance of different type of microbes that live in your gut. So while a healthy gut exists in a state of symbiosis, a balance, a dysbiosis means these microbes in your gut are out of balance. These microbes all produce different gases, including hydrogen, methane, and hydrogen sulfide and others, and each one will make you feel unwell. So many people experience symptoms that go far beyond occasional discomfort. This is not stomachache once every few months, it's a daily occurrence. So the bloating is severe, often described, from 1 out of 10 in the morning to 9 out of 10 or 10 out of 10 by evening time, so significant that they need different clothing sizes throughout the day. This is often accompanied by excessive gas, trapped gas, uncomfortable belching, and visible distortions. So when symptoms are this life-altering, it's time to look deeper at conditions like SIBO, small intestinal bacterial overgrowth, or other forms of microbial overgrowth. And research indicates that 14 to 78% of IBS causes may actually be, overgrowth of certain bacteria. And the core issue is an overabundance of gas-producing microbes in your gut. So there are 4 types of this microbial imbalance, and each of them have different characteristics, right? So the hydrogen SIBO, this involves an overgrowth of bacteria called E. coli that produces hydrogen gas. When these microbes overpopulate the small intestine, they interfere with digestion and nutrient absorption. And the classic sign of hydrogen SIBO is diarrhea, along with significant gas, which often manifests as excessive belching. And then we also have methane overgrowth of bacteria. So this is caused by overgrowth of archaea, a type of microbes. So it's actually not a bacteria. It produces methane gas. This type of archaea organism. So methane famously slows down gut motility, creating a vicious cycle of constipation and bloating. So a key identifier is the gas kind of smells. It's resembling a barnyard, or like chicken or chickens leaving. So, and the third one is a hydrogen sulfide, which is a intestinal sulfide overproduction. This type involves different types of microbes that produce hydrogen sulfide gas, and they are the same bugs that link to the inflammatory bowel disease like IBD. So, and it's actually causes symptoms like urgent diarrhea and extreme nerve sensitivity and sensation of bloat. And it smells like rotten eggs. That's how you could potentially identify that. And then we have the fungal overgrowth. So again, that can also cause constipation, and we do need to have some fungus in our digestive system. But when it overgrows, and again, it can overgrow because maybe you've taken antibiotics where you wiped out some of the good bacteria. Maybe the food that you're eating is keeping the fungus growing, especially when you eat a lot of saturated fat. Actually makes the sugar stay in your bloodstream longer. So fungi are drying and irritating, typically leads to constipation, bloating, belching, and nausea. And external signs can include itchy scalp, flaky itchy scalp, and you might even notice white specks in the stool. So recognizing these specific patterns is the first step toward identifying the root cause of severe digestive distress and creating an effective treatment plan. So you can heal and you can eat the foods without getting symptoms. So another question is, why do people have histamine reactions? And we worked with a lot of clients who have histamine issues because they still have an autoimmune disease. So the goal is not to avoid histamine-rich foods, is to heal your autoimmune disease so those reactions go away. But I'm going to explain why people have it. So you have to understand how the histamine influences your immune system behavior and response. So histamine enters the picture from several sources. Your gut bacteria produce histamine. Even beneficial bacteria release histamine and other immune chemicals as a form of communication. Depending on your unique gut balance, your microbes could either be helping to break down histamine or contribute to a significant release of it. So again, if your gut is not healthy, you may be releasing more histamine. Histamine is also present in the food you eat. As you digest food, you're also processing biogenic amines, which include histamine and other bioactive compounds. So your body produces histamine internally. Your histamine levels can rise due to seasonal allergies, emotional, physical stress, which increases adrenaline, hormonal fluctuations such as rising estrogen, illness, exposure to mold, which activates immune cells called mast cells to release histamine. So the reason histamine causes such widespread symptoms is that we have histamine receptors throughout our entire body. Nearly every organ has them. This means that when histamine levels are high, the entire body can feel the effects. So managing histamine effectively requires a two-part approach. not overproducing it, being able to break it down efficiently. So what does this mean? It means that you have to have a healthy gut and healthy immune system to be able to break down histamine and not to overproduce it. So when your gut health is, that's why your gut health is absolutely critical. Your gut barrier is primary site for producing the enzymes needed to break down histamine. So the most important of these is DAO, which is produced mainly in the lining of the small intestine. And the second enzyme, HNMT, is produced predominantly in the liver. So when your gut is damaged, or your liver is damaged, or your liver is inflamed or overwhelmed, your production of these enzymes goes down. When you can't break down histamine effectively, it builds up in your body and you may start to notice a wide range of symptoms, often triggered by food, stress, or past illnesses like COVID. So these symptoms can affect multiple, like people getting headaches, migraines, dizziness, brain fog, reducing heart rate after eating or exercise, shortness of breath, sneezing, congestion, postnasal drip. We had clients who had all of these symptoms. We had clients who had eczema. They were able to heal their eczema. Hives, flashing, itching. Many classic IBS symptoms like bloating, gas, diarrhea, abdominal pain, constipation, nausea, and vomiting. So if you notice these symptoms emerging, especially if you never had allergies before, or if they begin after a virus or a course of antibiotics or specific food intolerance, it's essential to discuss, possibility of histamine intolerance and also learn how to heal your body so you stop having that. And your gut produces enough of the enzymes to break down histamine and you heal your gut barrier, which can allow you to be able to tolerate histamine. So again, the solution is never to just avoid certain foods that are giving you issues, but to heal and address the reason why you're having those issues. So if you're working with a functional doctor for 6 months or longer, it means that they do not know how to fix your problem. Most of the clients, if you go to a website, you can see the type of results that they're getting. We worked with them for only 40 days. And they were able to see results. So you can continue working with doctor, do take a bunch of supplements, but if you're still having issues, it means something needs to be fixed. So another, food sensitivity testing. We find so many called experts and practitioners heavily promoting food sensitivity testing. Is this testing actually useful? So the answer is straightforward and it's a no, okay? Here's the critical reason why. These IgG tests do not identify the cause of your problem, such as dysbiosis or what damaged your gut barrier. Instead, the test simply measures what food particles have entered your bloodstream, and the IgG immune system is located in the blood. So a positive result often just indicates that you have leaky gut. That's all it means. So, and you're gonna see the tests that show up in your blood tests are the foods that you eat more frequently. So it's very common for patients to show us these results, which are highly reactive to all the foods they eat regularly. This makes perfect sense because a leaky gut allows these frequently consumed foods to pass into the bloodstream, triggering IgG response. So this is a sign of the leaky gut itself. A true sensitivity test, it's not a true food sensitivity test, okay? So basically, if you have a test if you do the IgG test and you get results for your IgG test that you are reacting, you have intolerance to certain foods, it just means that you've been exposed to it, and it just means that you have leaky gut. And it's going to show you the foods that you eat most often. That's all it's going to show you, that you have leaky gut. So oftentimes people look at their test and they say, oh my God, I have a sensitivity to banana. I'm going to avoid eating bananas. So it just means that you have leaky gut. That's all it means. So testing for IgE can identify true immediate allergies, and measuring IgA can provide information about intolerances inside the gut. However, the popular IgG food sensitivity tests do not offer this kind of actionable insight. They merely confirm that your gut barrier is compromised. It's all this IgEs, the food sensitivity test it just measures exposure, not intolerances. Okay, so it just confirms that you have leaky gut. So the better approach, that's what I'm telling you, the better approach is strong recommendations to stop doing these tests, invest in a program that's going to help you heal your body, healing your gut lining. And that's when you're working with anybody, it's also crucial to be an advocate for your own health. Before agreeing to any testing, you should always ask a few key questions. How will the results of this test change your specific recommendations for me? And what is the total cost? And most importantly, what happens if I do not take this test? So if a practitioner insists you must spend hundreds of thousands of dollars on a test panel before they will even begin working with you, consider this a major red flag. This approach suggests that they're treating lab report instead of treating you, the individual. A skilled practitioner uses tests to inform a diagnosis, not to replace one. So with our clients, people ask us, how do you help people heal? Because we have a decade of experience helping people recover. We invested over $500,000 into our program, into our own education. And we also run a research lab since 2010. So it's been 15 years. So that's why we have experience helping people heal rather than rely on hundreds of tests or supplements. So our approach is a supplement-free approach. If you're looking to get help, then you can book a consultation. We review your form. And if you feel like we can help you, we'll invite you to work together to help you finally recover rather than rely on a bunch of tests and symptom management. And I hope this presentation was useful to us. Reach out to us for any questions you may have.